Hello, my name is Albert. I am a student PT, and today we will be taking a range of motion test of shoulder flexion. So basically, we'll just be seeing how well your shoulder is moving, how well you can move your arm upwards and up as far as you can. So I'll just be taking some measurements of basically how well you're moving your shoulder. Is that okay with you?
Yes.
Alright, so first I will show you the motion that you'll be going through. So I need you to have your arm straight to the side, and you'll be keeping your arm extended like this while you'll be moving your arm up and out, okay?
Okay.
So you'll be moving your arm upwards like this, keeping your hand straight and going as far as you can. And then do not have your back extended, do not move your back like that, okay?
Okay.
So the axis will be the lateral midpoint of the acromion process, and the stationary arm will be the lateral side of the thorax, and the moving arm would be lateral to the humerus going down to the lateral epicondyle. So can you move, can you flex your shoulder for me?
Yeah.
Okay. You can relax now and put your arm back. So it is 165 degrees. How do you feel? Is everything okay?
Yes.
Cool. Hello, my name is Albert, and I'm a student PT, and today we will be measuring how strong your shoulder flexion muscles are, especially targeting the anterior deltoid. So in simple terms, basically we'll just be seeing how strong the muscles are at lifting your arm upwards. Is that okay with you?
Yes.
Alright, so what I need you to do is have your arm, your side, and then we need you to extend your elbow and lift it to a 90 degrees. Alright, so I need you to hold it, and then I will be stabilizing you at your shoulder, and I'll be pushing down onto your arm. And do not let me push your arm down, okay? Hold it.
Okay.
1, 2, 3. Alright, was there any discomfort or
No.
pain? Okay,
No.
you can lower your arm down now. Because she was able to resist and I was not able to break her, I will give the MMT test a 5 out of 5. Hello, my name is Albert. I am a student PT. Today we will be assessing the range of motion of forearm pronation, which is basically just seeing how well you're able to rotate your forearm and having your palm face downwards. Is that okay with you?
Yes.
So first we have the patient sitting on the edge of the bed, and then now can you flex your elbow to 90 degrees like this, and then have your hand in a neutral position. So the axis will be next to the styloid process of the ulna, and then the stationary arm will be to the anterior of the humerus, anterior midline of the humerus, and then the moving arm will be the dorsum aspect of the forearm that is proximal to the styloid process of the ulna. So what you will be doing is you'll be rotating your forearm with your palm going towards, facing downwards, like this. Okay?
Okay.
Alright. Now can you rotate your arm downwards? Thank you. Okay, and relax now. So I have 61 degrees. Hello, my name is Albert. I am a student PT. Today we'll be assessing doing a manual muscle test of your forearm pronation muscles, specifically targeting the pronator quadratus and also the pronator teres. So basically this is just a measurement of how strong your muscles are at your forearm at rotating your arm towards downwards. Is that okay with you?
Yes.
So first we need you to have your arm flexed at a 90-degree angle, and then your hand will be palm will be slightly facing upwards in this is what's called like a supinated position. I will be stabilizing you at your forearm, and then you will be resisting me from pushing your forearm into more palm facing upwards direction. Okay, so you'll be going in a palm facing downwards direction like this. Okay, so you'll be resisting me. All right, so 1, 2, 3. Nice. Any pain or discomfort?
No.
Okay, so because I was not able to break her, I will give the manual muscle test a 5 out of 5. Hello, my name is Albert. I am a student PT, and today we'll be assessing a range of motion for wrist flexion. So basically, in simple terms, we'll just be seeing how far your wrist is able to bend. Is that okay with you?
Yes.
So for the patient, you want them to have their shoulder abducted to 90 degrees onto the table and have their forearm line resting on the table as well, and have their hand in a neutral position. So what we'll be doing is we'll be bending your wrist as far as it can go without flexing or bending your fingers while doing so, okay?
Okay.
So for the axis, it will be the triquetrum on the ulnar side of the hand, and then the stationary arm will be lateral of the ulna going towards the olecranon process, and then the moving arm will be lateral to the 5th metacarpal. Okay. Now can you bend your wrist as far as you can go? Okay. So there is 82 degrees of wrist flexion. Hello, my name is Albert. I am a student PT, and today we will be doing a manual muscle test for wrist flexion. So it will be specifically targeting the flexor carpi radialis and flexor carpi ulnaris. So in simple terms, we'll just be seeing how strong your muscles are at bending your wrist. Okay, is that all right with you?
Yes.
Okay, so the patient is seated, and then need to have their hand in a supinated or palm up formation. So now what we will be doing is you will be bending your wrist like this, okay? And then I will be applying resistance downwards, and don't let me push your or be able to break your wrist from bending, okay?
Okay.
And I'll be supporting your forearm with my other hand. So now can you bend your wrist? And then don't let me push down on the count of 3, okay? 1, 2, 3. Nice, you can relax now. Did you feel any pain or discomfort?
No.
Okay, because I was not able to break her, she was able to resist me. I would give the manual muscle test grade of 5 out of 5.